Optimal demonstration of the left ovary and adnexa. I then introduce the probe in the sagittal plane. Examine the left pelvic wall in the coronal plane. I then rotate the probe 90 degrees into the coronal plane and point the tip of the probe towards the left pelvic sidewall. The pelvic sidewall is difficult to visualize directly on an ultrasound scan. However, the iliac vessels are often used as a marker for the pelvic sidewall boundary. I now locate the iliac vessels using color Doppler. I then turn off Doppler and fully examine the left pelvic wall from the patient's anterior abdominal wall to the posterior abdominal wall. I ensure that I do not apply too much pressure to the patient. Examine the left pelvic wall in the sagittal plane. I now rotate the probe in the sagittal plane and fully examine the left pelvic sidewall from the patient's midline to the patient's left. I ensure that I do not apply too much pressure to the patient as I do so. Locate and optimize an image of the left ovary in the coronal plane. I now rotate the probe into the coronal plane and press the split screen button. I then identify the left ovary. I then adjust the depth of field and then the gain to improve the appearance of the image. I now fully examine the left ovary by sweeping the probe in an anterior to posterior direction. I then find the largest diameter of the left ovary in this plane. I freeze the ultrasound image, I capture the image, and press the split screen button. Locate and optimize an image of the left ovary in the sagittal plane. I then fully examine the left ovary by sweeping the probe from the patient's right to the patient's left. I now find the largest diameter of the left ovary in this plane. If necessary, I adjust the gain to improve the appearance of the image. I then freeze the ultrasound image, I capture the image, and keep the ultrasound image frozen. Measure the left ovary in the coronal plane. On the left half of the screen, showing the coronal ultrasound image, I measure the maximum diameter of the left ovary from the right side to the left side of the patient. I then keep the ultrasound image frozen. Measure the left ovary in the sagittal plane. On the right half of the screen, showing the sagittal ultrasound image, I measure the maximum diameter of the left ovary in the anterior to posterior direction. I then measure the maximum diameter of the left ovary in the caudocephalic direction. I then estimate the ovarian volume. I capture an image, and then turn off the ellipsoid volume function. I then unfreeze the ultrasound image and press the split screen button. I now find the largest diameter of the dominant follicle. I freeze the ultrasound image, capture the image, and keep the ultrasound image frozen. Measure the dominant follicle in the sagittal plane. I now measure the diameter of the dominant follicle in the anterior-posterior direction, and then measure the maximum diameter of the dominant follicle in the caudocephalic direction. I unfreeze the ultrasound image. To complete the scan, I withdraw the probe, taking care not to exert too much pressure on the patient.